Dr. Daniel, thank you so much for being here today to talk about gut health. I thought before we got started that it would be great if you could just give us a little intro and tell us more about yourself and what you do.
Yeah, absolutely. First, Melanie, thank you very much for having me on here. I was looking forward to this conversation. So, my name is Dr. Daniel Ricciardi. My background's actually in pharmacy. So, I got my doctorate of pharmacy back in 2012 from St. John Fisher College in Rochester, New York. So, from there, I actually practiced as a pharmacist in different jobs for almost a decade. And there are a couple things that led me to ultimately transition to what I'm doing now, which is gut health from a more functional medicine, holistic kind of platform. First is saw a lot of people in pharmacy that they do everything that they were supposed to do perfectly, and yet despite this, they still kept getting worse. So kind of thought in the back of my head, there's something that we're missing here that we're not doing. And then the second reason, probably the bigger reason, was I had horrible digestive problems I'm 35 now, for probably my entire 20s. I had SIBO, so dealing with bloating on a daily basis was something that was the worst one. I also was passing a lot of gas constantly, and then was also affected by brain fog. So fixing SIBO was kind of like an eye opener, like, hey, like I can actually do this stuff too for other people. So that kind of led me to transition to what I'm doing now, which is like one-on-one coaching at the moment for clients with all sorts of digestive problems, mainly SIBO.
We should also tell people how we connected. So, you and I are both partnering with Wise Human. And when I was investigating the supplements, I actually saw your testimonial on their website. So, that's how you and I got connected. And while I do a little bit of gut health stuff because you can't help not do it in what I do, I was thinking it would be really good to get somebody who was more of an expert to answer some of the questions that I commonly get from clients, because I get questions about gut health all of the time. So today we're going to get into bloating and aging and so much more. So this is going to be really helpful for a lot of people, I'm sure. So, jumping right in, obviously, we have a lot of questions about bloating today. But before we get into those questions, what I wanted to do is get you to talk to us a little bit about how does somebody actually know if they're bloated? Because I get questions from clients all of the time saying, "Oh, I'm so bloated," but I think that there's probably an unrealistic expectation from a lot of people that their stomach is going to be flat all day long. And so I thought it would be helpful if you could let us know, how do you know if you have bloating, and what's just a normal change in your stomach throughout the day as you consume food and water?
Yeah, it's a great question. As somebody that dealt with bloating for many years, it's definitely something I've wondered to myself probably thousands of times. So I think there's like several things I kind of think about when it has to do with like, is it bloating, or is it just I ate a large lunch and it's kind of weighing heavy on me? To your point though, Melanie, like not everyone's going to look, you're not going to look exactly the same as you did when you wake up compared to when you go to sleep. I don't think that having like a completely flat stomach and then going to look like you're 6 months pregnant at night, like every day, I also don't think that that's completely normal. So there's a gray area of what is normal to expect to happen and what is not. So a few things I've noticed, ways to know that you're bloated as compared to just a normal day fluctuation, how you feel, is if you feel the exact same like before you started eating compared to after like a large meal. This was probably one of the first things I noticed when I would always be bloated. I'd go into the meal, I wouldn't even feel hungry. I'd feel full already. And then after the meal, I feel like nothing really changed. It was kind of the same from before to after. I think with bloating, just because a lot of the time there is excess gas in your intestines, I find it a little bit more difficult to breathe. Not even when you're exercising, but just sitting in a chair like we are right now. Kind of has a little bit more of an inflated feeling, which you probably could only really understand if you have felt bloated or know what it feels like on a regular basis. And then the location of it as well is also something to think about. Like our stomach is in the middle of our abdomen. It's probably higher than people think. It's not down near the belly button. It's just a little bit below the sternum. So if you have kind of a full feeling there from eating a meal, that's a normal thing. But if you're feeling it down by the belly button or in the sides, I'm kind of gesturing. I don't know if you can see my hands or anything.
Yeah,
Probably not.
yeah, I
I'll
can
just
see
keep
it a
doing it
bit.
anyway. Those would be signs of bloating. And then, yeah, the last thing I have, took a few notes here, obviously, but just not feeling hungry during a normal mealtime. Like sometimes that just takes the edge off. Like you don't really want to eat if you already feel like your stomach is full. So, on the other hand, not being bloated after eating, your abdomen like may expand a little bit, but it shouldn't be really significant. It should look other people shouldn't be able to notice the difference in it, although you may be able to notice it. Where if you're bloated, it can be noticeable for other people that are onlooking as well.
I think that's really helpful to know and something that I could even ask my clients. So, getting into some of the more specific questions, so a lot of them had to do with vegetables because think my clients are fairly healthy. They tend to stay away from junk food, but I have a lot of ladies that are really diligent with trying to eat really healthy. They do a lot of veggies, they do a lot of raw veggies, and so a couple of the questions that we have, for example, Sarah asks, it seems the healthier I eat, the more my stomach is bloated. Things like chia seeds, broccoli, vegetables, they all bloat her. And she asks, is this normal or is this partially perimenopause because she's at that age? And we had similar questions from other ladies as well. So I suppose the first part of that is that are there certain healthy foods, like say, for example, raw vegetables, that will cause you to feel more bloated?
Yeah, that's a good question. I think when I hear feeling more bloating from eating healthy foods or a really clean diet, the first thing that I think of is SIBO. Because when we talk about healthy foods, vegetables, fruits, almost all of these are containing fermentable sugars, carbohydrates, fibers. Probably the two biggest ones in terms of SIBO and fermentable foods are garlic and onion. But otherwise, that's the tricky part with SIBO because you've been told your entire life eat these foods, do these things, like don't eat junk food, and yet despite the fact that you're actively doing everything you're supposed to, like avoiding junk food, eating the healthy food, you're feeling worse. So this is like it's kind of like one cue that clicks in my brain to like look a little deeper and maybe look at testing for SIBO if I hear that. But yeah, some big foods like vegetables, you mentioned raw vegetables. It is true that well, I shouldn't say it's true because it depends on the person, but for most people, cooking vegetables makes them a little bit easier to digest than eating them raw. So if this is a concern, I would probably recommend trying to cook the vegetables. From then, it kind of depends on which fruit. There's obviously different fruits and vegetables which can be fermented more. Some things like blackberries, avocados, cherries, ripe bananas, dried fruits is a big one, asparagus, Brussels sprouts, some fermented foods like pickles and the sweet corn. They all have the propensity to produce more gas in the digestive tract because they can be fermented more by bacteria, which normally isn't a problem. We normally want this, and that's why these foods are considered healthy. But with SIBO, you have exponentially more bacteria, and they're just feasting on these fibers and carbohydrates and producing all this gas. And then we're left wondering what the heck is going on.
So some of it might be normal, and maybe the first thing to do is to try to cook your food. That's one of the things I always tell my ladies is, maybe don't eat raw vegetables. I know even for myself how much different I feel if I eat a raw salad or if I do something cooked. And I definitely prefer to do things like vegetable soups and that kind of stuff over raw vegetables because I just know that my stomach is more comfortable when I eat that way. And I've just learned that over the years. So I think maybe starting with a bit of testing, and if you're still having problems, then maybe that's when you get into looking at SIBO and that kind of stuff.
Yeah, that's really good advice. You could even try just doing a low FODMAP diet for a week and say, okay, I did this diet, maybe it didn't help at all. Then maybe SIBO is not something that's affecting you. But if you do the low FODMAP diet and you feel maybe 30 to 50% better, it's not going to get rid of it, but at least might point you in the right direction to say, hey, like this could be something here that I should look into more. But yeah, totally agree.
A lot of questions about perimenopause because I think a lot of ladies are finding that when they're hitting their mid 40s, they're starting to notice some changes with their digestion. So, what's true about that? So, what can we expect as we get older? Is there something that's changing in the female digestive system, or is it just general aging?
Yeah, there's two things that really come to mind. First isn't necessarily female specific, but it is age specific, which is it's just a fact that our stomach acid levels decrease over time as we age. I don't remember the exact percent, but I think it's estimated when you're 60 years old compared to 30, its stomach acid is about 50% less, which is really significant and something that it's not really talked about, but it affects our digestion and a lot of other things indirectly. So stomach acid, it usually gets a bad rap for causing heartburn, but it's actually, we need it. It's really helpful. It's going to digest our food, break food down into smaller particles in the stomach so they can clear the stomach quicker and get into the small intestine. Because if this isn't happening in a timely manner, the longer the food sits there, the more opportunity it has to ferment, produce gas, and this is where belching, burping, bloating, you'll experience a lot of these things more. So the second part of that is perimenopause and how it affects women a little bit more as they age. So going through perimenopause, there's hormone changes, obviously. So estrogen decreases as well as progesterone. These are known to cause bloating when this happens. Like this is already a known thing. I wouldn't say that I'm amazing expert in terms of handling hormones per se, but if you are somebody, if you're wondering if this is affecting you and it's because of perimenopause, you can look and see, like, am I having other symptoms of perimenopause as well? Is it mood swings, vaginal dryness, other type of symptoms? And if other symptoms are affecting you as well, just trying to balance out the hormonal piece can be really helpful. So I'd say a few things that I have here would be just reducing like pesticides, household cleaners, things that contain what are known as xenoestrogens that kind of affect the levels of some hormones such as estrogen.
One thing that you might find interesting is that I actually just recently participated in online sort of conference about menopause. They had a gut health expert on for a while, and she talked about how when women lose their estrogen, their gut actually changes significantly and becomes a lot more like a man's gut, like in terms of the bacteria and stuff. And I need to learn more about this myself, but I just thought I would throw it out there so that everybody who's listening knows that there is actually something going on, and maybe for you this is something you can start looking into in your own work, because it sounded like something that we should know more about. So something for me to investigate and yourself. And I suppose the other thing that they did talk about in that webinar was just that when women are going through that change, often they will be given things like birth control pills and other things to manage it, which can significantly disrupt your gut bacteria. So those are all things to consider, as well as, like you mentioned, the xenoestrogens, and just making sure that you're doing absolutely everything to balance your hormones. And I would say, in my work, one of the things that I know about perimenopause is that it's a hugely stressful time. And I've seen on your Instagram, you've talked a lot about the importance of managing your stress if you want to get your gut feeling better. So I think that that's probably a big piece of the puzzle for perimenopausal women that is not necessarily age related, although it is, because as we go through perimenopause with all the fluctuating hormones, we aren't as good at managing stress. So that's my 2 cents on what also might be going on.
Yeah, I absolutely agree 100%. It's tough that's the toughest one to do also, like everyone says, don't be stressed out, but it's like we all have things we care about. There's things lingering next week that we want to do, stuff coming up. It's a major topic, and I don't know, everyone has to pick some things that will work for them in terms of reducing stress.
One of the other questions we had about bloating was, does the time I eat affect bloating? So this question was from Amy, and she asked, if I eat before bed, does it affect bloating?
Yeah, I think that's a good question, because with most people, right before bed's typically the time that if they have bloating, like it's probably going to be the most severe. So taking that into consideration, I still don't think it matters doing like 2 hours before bed. I still don't think that that's that big of a deal to do, with the caveat, as long as it's not preventing you from getting a good restful night's sleep and it's not going to give you heartburn. Like, there is research that suggests that if you are getting really poor sleep, it leads to you having more of a leaky gut, which definitely can affect digestion and bloating. So that is a thing. But if you're not having heartburn and you're sleeping well, I don't really see a huge issue with doing that. At the end of the day, there's just so many little things that we can kind of poke and pick at here and there, but I kind of want to focus on stuff that's going to be the most important for the most people. I don't want to be the guy that's saying, oh, you need to have a teaspoon of cinnamon 40 minutes after you wake up because it'll improve your brain function by 20%. Like, that's cool if you like that, but in terms of the timing, I'd say maybe don't eat like immediately before bed, but 2 hours. Sure, like I don't see the problem with doing that.
Moving on from bloating, I thought that one of the most important things we should probably cover is bowel movements, because it's something that a lot of women struggle with, and I suppose it would be good, without going into too much detail, just to get an idea from you as to what's a normal bowel movement.
Sure, we'll go to a lot of detail, Melanie. No, I'm just kidding. Yeah, so if you're constipated, obviously it can definitely lead to having more bloating if you're not moving your bowels. The first thing I'd probably have people do is just Google on your computer or phone Bristol stool chart. Gives you a list. There's like a photo of each type of stool and it ranges from 1 to 7. 1 is tiny, hard, small pellets, and 7 is completely liquid. Obviously, neither of those is where you want to be. Well, maybe I shouldn't say obviously. For some people, a 1 may not flag as weird at all. But a number 4 is right in the middle. It's just like a regular log-shaped bowel movement. Having one number 4 per day is probably ideal. I don't want to nitpick on the type of stools. I think it depends really how you feel. Some people, if you're having 3s, you feel great, that's fine. Or if it's 5s, I think that's perfectly fine as well, as long as you feel good. Even if it's maybe every other day and that's your normal cycle and you feel great, I don't think there's any red flags with that. I do think it's probably abnormal and not ideal if you're going to the bathroom and passing a bowel once every 3 days or once every week. There's only a handful of ways that your gut can tell you, something's wrong, and just having bad bowel movements is one of them. So I would say that would be the best way to know if your bowel movements are healthy.
That's great. I'll try to find that tool and link to it in the description of this video as well, so it's easy access for people watching. So then we had some questions about testing. So if people are interested in finding out if they have SIBO, if they have more serious problems, where do they start with testing?
I think it's important just to keep in the back of your head that the foods themselves are not always the issue. Like, it can always be something like SIBO, leaky gut, parasite, like a fungal infection, low stomach acid. But assuming the foods are the issue, like trying to get down to how to figure out which ones are doing it, there's like 2 base things that you can do. One is food sensitivity testing, and the second one is a structured food elimination and reintroduction of that food. So with the food sensitivity, it's different than a food allergy. So I want to make this point really clear on this test. Like, a food allergy, I think we all really know what that is. If you see an actual food allergy, somebody ingests a food, you immediately get maybe a swollen face, trouble breathing. It's kind of an emergency situation. It happens quickly. A food sensitivity test is very different than this. It's an inflammatory response, but a much mellower inflammatory response. It actually may not happen even for like hours to even days, like up to a couple days after you're exposed to that food. So it's a much different reaction. And it's another reason why it can be so hard to detect these if you have a food sensitivity to something. So doing a test like this would be one potential way to identify foods that can do that. One other big point I want to make on food sensitivity tests is it's only going to identify antibodies if you're eating a certain food. Let's say, for example, like you haven't been eating dairy foods for a year because you thought they were bothering you before. If you go to take a food sensitivity test and you've been perfect at eliminating all dairy, you haven't accidentally had some in a sauce or anything, that test is probably going to show up that you have no antibodies and no sensitivity to dairy. So that's one point I just want to make clear when doing the test, because I've seen this with people where they're negative on a sensitivity test and then they go to introduce that food again. They're like, oh, this is great. I can eat blah, 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 like all these foods. And then they feel worse again. So
Just to wrap it all up, what I thought we would get from you is just some final thoughts from you in terms of, is there something that we all should be doing? Like, what are your top tips for gut health? And one of the questions we did have in this regard was, should everybody be taking a probiotic?
definitely. Yeah, I guess I'll answer the first question, like things everyone should be doing. And yeah, I really like this because I feel like I can tell everybody all at the same time what they really should do without excluding anybody or trying to, yeah, mince words at all. So these are things, there's a few different terms for what category these all fall into. I say eating hygiene, which some people may call it other things with the category of what these tactics are. But first one that I love to do, this is probably my favorite one, is drink as little liquid as possible during meals. And this is just in an effort not to dilute stomach acid. As we talked about before, we need strong stomach acid to digest and break down the food. If we're drinking 24 ounces of water in the middle of a meal, then we're just diluting stomach acid. So hydrating is really important. I don't want to make it sound like it's not. Just do that not when you're eating. So I'd say go 30 minutes before or after your meal. Make sure you're hydrating well, like at any other time. I like chewing food really very thoroughly and consistently. So I usually say until applesauce-like consistency, applesauce or jelly. If you do this, the food particles are smaller, stomach acid has less work to do, your whole digestive tract has less work to do. I like to use the Coney Island hot dog eating contest as an example. I think it's kind of gross. People are swallowing food basically whole. I'm just sitting there thinking there's no chance they have it digesting that. So that's what not to do. Eating slower is also really important. So I think 20 to 30 minutes to sit down and eat is a good goal to set for eating. If you're chewing very thoroughly, you probably won't be able to finish a meal much quicker than this anyway, I guess depending on what the food is. And it helps too, just with weight loss and everything. I know not everybody wants to lose weight, but if you are, a hormone called cholecystokinin is secreted into the small intestines after about 20 minutes from when you first start eating. And this signals back up to the brain. That's when you start feeling like you're getting full. And there's actually research on this where if you're eating slow, like the 20 to 30 minute range compared to really quickly in 5 minutes, on average people eat over 300 calories less per meal. So if you add it up, 3 meals a day, that's 1,000 calories less per day, like without trying. I think that's helpful for a lot of people. Yeah, and then finally, just avoiding stressful activities while eating is also a huge one, which I think you mentioned too earlier, just reducing stress in general for digestion. Digestive secretions, stomach acid, digestive enzymes, bile, they're all reduced when we're stressed out because we're in a fight or flight mode. Our body can do amazing things, but isn't smart enough to differentiate the fact that we're stressed because we're working while we're eating compared to our life is in danger. It doesn't know the difference, so it's in that fight or flight mode. So those would be my final, I guess, takeaways for like what everyone should do. And then benefiting from taking probiotics, I believe was the other question. I would say there's 2 key times where I think they're really good to take, where I'd say like everybody should do them. And first would be after taking a course of antibiotics, because antibiotics, they're eliminating infection, which we need to do, but they also eliminate a lot of the microbiome and good bacteria. So you're kind of in your microbiome's in a Game of Thrones state where all these bacteria are basically battling for territory and trying to grow and take up the most space. So during this time, adding some good bacteria can be helpful in preventing bad bacteria from kind of taking over the microbiome. And then the other one I would say would be if you have loose stools regularly, there's several strains of probiotics that there's a lot of research on them that show that they're really helpful for loose stools. Some of them are Saccharomyces boulardii, Lactobacillus rhamnosus, GG, Lactobacillus plantarum, and Lactobacillus acidophilus. I actually did a YouTube video just on this, looking at as much data as possible, and these strains were the ones that were really studied. And that's another reason I like Wise Human, because these 4 strains are in all of their products. So if you have loose stools, this is the probiotic that you want to take. For everybody else, I don't know if it's always necessary to do so. I would say in general, try to get prebiotic, which are fiber, to feed the probiotics just from a wide variety of foods, such as fruits and vegetables, other foods that contain fiber as well. This, for a lot of people, can be plenty to have a good, healthy microbiome and good bowel movements. So I don't think it's necessary for everybody to go out and take a probiotic.
Well, I really appreciate you taking the time to be on here. And before we let you go, why don't you let everybody know what your website is and where they can find you? And I will link to all of that in the description of this video as well.
Awesome. Yeah, it's really simple. Everything's just my name. So it's Dr. Daniel Ricciardi. So Dr. Daniel Ricciardi, Ricciardi. My website's drdanielricciardi.com, and all my socials is Dr. Daniel Ricciardi, YouTube, Instagram, TikTok, Facebook.
Thanks again for being here, and we will stay in touch.
Thanks so much for having me.